Half a dozen newly born babies and mothers have died in the last 6 years at an island community of Faana in the South Municipal Assembly of the Greater Accra region. That is according to residents of the community trapped in between the sea and lagoon with no access to health care. Other inhabitants and pregnant women continue to die and deliver in canoes as a result of traveling for over 1 hour in paddled canoes to access healthcare. Now, Joynews' Henry Kwesibedu returned from that community and has more in the following report.
35-year-old Kwame recounting how her wife in 2018 delivered their first child in a canoe en route a chief's compound miles away from the island community.
I went fishing when my wife was in labor. She delivered on her way to the hospital in a canoe. The hospital is very far from where we live. I was afraid something might happen to my wife because the health center was a distance away.
His wife is lucky to have survived, but the fisherman is worried because his wife is now 7 months pregnant, expecting a second child soon.
I am now afraid that something may happen to my wife the next time she labors.
The only way to access the community is by canoe. With no electricity, water, and other basic amenities, pregnant women and other members of the community in dire need of healthcare will have to risk their lives by sitting in paddling canoes without life jackets for close to 1 hour to reach the nearest health facility.
There is no clinic here. There is no anything that can help an individual or people here so that they will be able to give birth. That is why normally when they are in a labor, people normally convey them in a boat to Chokome or the other side, that is Pamblos, before they can do deliver.
Rosemary Dasi is also a resident here. Her water broke in the dead of the night last year. With no canoes operating in the night and no traditional birth attendants, she had to wait for 4 hours to get a canoe, enduring severe pains and putting her life and the baby on the edge.
It started around 1 a.m. I felt funny, and my husband called his mother and grandmother. They confirmed my time was due. The canoe came around 5 a.m.
Rosemary delivered, but she does not want to relive the same experience.
I was in pain and I couldn't sit in the canoe. After an hour, we got to the banks of the river and I was told to quicken my steps. I got to the hospital and delivered safely, but it was a horrifying experience.
Pregnant women aren't the only victims here. Other sick persons face similar challenges too. They rely on first aid until they get access to canoes, which are not readily available. Rosemary now has 2 children. She tells me how she takes care of them anytime they are unwell before seeking medical attention.
I take my children through steam inhalation or give them some herbs anytime they are unwell until I get a canoe.
Health personnel visit the community occasionally to provide life-saving health services like immunizing their babies. Today is one of such days, and we tag along community health nurses at the Botiano Clinic as they embark on a journey to Faana. We finally reached the community trapped between the sea and the lagoon. Onansis Kankam is a visiting nurse.
If there is money, there is every 2 weeks we're able to come. But if there is not money, once in a month, then we try our best and then come. Yes, yesterday, a similar one just occurred. But by God's grace, we were able to say
what happened? Can you narrate what happened to me?
You see, there are a certain area that when we get, the sea has just joined the lake. So it makes it difficult to pass through the waves. So we were stuck. But let me say, with the techniques of the captain, that is the one driving the boat, and by God's grace, we're able to say today it's not easy. It's not easy. If you don't, if you are not a man, let me say that if you are not a man, you cannot come. You rather go back, or you feel reluctant to come to this particular area to work.
An asthmatic patient died here earlier this year. Sister of the deceased, Gifty Akoli, spoke to us.
He had complications and died in a canoe before he could reach a health facility.
Half a dozen newly born babies have died in the past 6 years because they could not get to a healthcare facility early enough. Son of the chief of the community, Bismarck Joynews, tells us more.
Actually, bear to my knowledge and based on what I've come to, clinically about 6 people who have delivered on the way. Bear to my knowledge, that's what I've heard and what I've seen. But clinically, 6 people have delivered on the way.
And how many have lost their babies?
Yeah, actually, that's 6 people that I'm talking about. 4 people lost their baby on the way. 4 people lost their baby, and 2 have lost their life. 2 people lost their life, and 2 people lost their baby.
Until the government comes to the aid of the community in dire need of healthcare centers like that of Faana, many lives will continue to be at risk. Henry Kwesi Bedu for Joynews.